Healthcare Quality Improvement Initiative in Patients with Diabetes. Introduction. Molina Healthcare is a company that provides managed healthcare services under Medicare and Medicaid. The company's purpose is to deliver high-quality care to those people who receive government assistance. Nowadays, healthcare systems encounter different problems related to members' outcomes and patients' health status, and they should develop quality improvement initiatives to address these problems. One of the vital issues that needs to be addressed is the growing number of people with diabetes. This executive summary will focus on the Quality Improvement Initiative aimed at diabetes, its benefits, interprofessional collaboration, the cost justification, and the initial evaluation criteria. The purpose of the Quality Improvement Initiative. The goal of the Quality Improvement Initiative, QII, of the Molina Healthcare Company is to improve health outcomes among enrollees with diabetes. Diabetes affects about 8.5% of the adult population. Deficiencies in care lead to various complications, premature mortality, and extra expenses on health issues that might have been prevented. Thus, the purpose of the QII is to develop interventions that will help change provider conduct, develop new systems that will make healthcare more efficient and error-safe, and implement health promotion activities. Moreover, the QII aims to train healthcare professionals to improve type 2 diabetes mellitus management, working in a patient-oriented and accessible environment. Target population. The target population of this QII is the enrollees with diabetes mellitus. The most significant emphasis will be made on veterans and the older population with diabetes. American Diabetes Association, ADA, recommends that physicians set a target A1C level of under 7%, 8.6 millimoles per liter, and control HbA1c levels every 3 to 6 months. Those patients whose HbA1c level is higher than 9% require special attention because they are at hazard of blindness, end-stage renal disease, and other adverse health outcomes. Therefore, these patients should be considered the target population. The benefits of the Quality Improvement Initiative. The primary benefits of the Quality Improvement Program are related to patient health outcomes. Thus, if Molina Healthcare improves the healthcare system, it will diminish possible failures and redundancy. Moreover, the health professionals' performance will also be accelerated. The program is designed to ensure patient safety and engagement, patient-oriented communication, evidence-based support and care, and health education for patients. Another advantage of this initiative is its proactiveness. The upgraded processes will help identify and solve the problems before they occur. The initiative is cost-effective because it is aimed at the prevention of adverse health outcomes. Thus, the costs needed for dealing with failures, errors, and complications of diabetes will be saved. Finally, the QII is efficient because it diminishes unnecessary activities related to equipment, supplies, energy, and ideas. The interprofessional collaboration needed to implement the QII. Interprofessional collaboration is essential for the implementation of the QII. Collaborative teams will be created to support patients with type 2 diabetes mellitus. Such teams should include a chronic disease management nurse or diabetes educator, pharmacist and/or dietitian working in the practices of family physicians. The interprofessional collaboration will help improve preventive care and patients' education and diminish costs associated with health care. On the one hand, it may seem that involving several practitioners will be more expensive. However, collaborative work will result in faster and better outcomes, thus saving time and money for healthcare. The cost of budget justification. Patients with diabetes require significant costs associated with drugs and cardiovascular disease. Thus, the cost-effectiveness of the QII should be measured and evaluated further. According to Perel et al., with the cost of about $19 per patient for the QII over 2 years, the cost-effectiveness was reported to be significant. If the patients with diabetes have fewer complications and improve their quality of life, the Molina Healthcare Company will save money on treating those complications. The QII will require calculating the costs for program management and annual cost savings. Thus, recent research showed that the implementation of a similar QII would need $130 per patient with diabetes in the United States of America. One can see that the quality improvement program is not cheap, but if it has long-term effects on patients' quality of life, it will show cost-effectiveness in the future. The basis upon which the QII will be evaluated. The QII will be evaluated based on the theory of change. The theory of change consists of three main pieces: the what, the context, and the how. This approach will help evaluate how the new activities will lead to the desired short-term and long-term outcomes, discover the barriers to the program implementation, and assess the availability of resources needed for the initiative. Suppose the stage of improvement is associated with favorable long-term outcomes, and these changes outweigh the costs needed for the QII implementation. In that case, the program will be considered cost and health effective. On the other hand, if the changes are insignificant and health outcomes are short-term, the program will need to be modified. In conclusion, the Quality Improvement Initiative is crucial for Molina Healthcare because the company has a significant number of patients with diabetes, and it aims to increase this number and improve the quality of life of such patients.